No surprise to anybody here that we face a public policy collision between data sharing and data privacy issues, and I'm going to try and address some of those issues. I believe that there's a great societal value to de-identified data, that it provides an invaluable public good, and that it's an essential tool for our society in supporting scientific innovation and research. It helps drive forward innumerable scientific and health research advances, and it greatly benefits our society as a whole, and yet still provides strong privacy protections for individuals. As we move towards expanded health IT and electronic medical records, it will yield even more de-identified clinical data, which I believe will support important advances in health science. Unfortunately, the inconvenient truth is that we're stuck with a trade-off. We can't have our cake and eat it too. When we de-identify data, we necessarily degrade that data in different ways, either through overt information loss, like restricting dates that are more specific than a year in HIPAA, or through the trade-off of grouping people together, for example, so that they're not observable as specific individuals. Unfortunately, there's been the driving force, I think, behind public policy has been largely anecdotal, based on fairly limited evidence, a fair amount of privacy folklore, and unfortunately targeted re-identification attacks, which targeted vulnerable populations for re-identification, particularly easily re-identified populations, as opposed to looking at the entire body of evidence for an entire group of people and saying, here are what the average risks are. It's important to know what the vulnerabilities are, but if we don't get down to the specifics of what are the overall risks, we're not able to make good policy decisions. Two misconceptions that I think exist about, I'm speaking specifically about in the HIPAA de-identification context, so this is data that comes from the provision of care and comes out from underneath that for the availability for research use through the de-identification provision of HIPAA. It's been claimed that de-identification doesn't work, that it's easy, it's cheap, it's powerful, and that re-identification is easy, cheap, and powerful. And I think in the pre-HIPAA context, that's probably the case. Estimates for the combination of 5-digit zip code, birth date, and gender together range from 87% at the high end to a recent replication done by LaTanya Sweeney, who's here, where she was able to achieve 27% re-identification of individuals in the Personal Genome Project using just 5-digit zip code, birth date, and gender. The reality is that HIPAA-compliant de-identification provides important privacy protections. The estimate for the safe harbor de-identification was that about 4 in 10,000 individuals might be re-identifiable. So the reality is that under HIPAA de-identification's current requirements, re-identification turns out to be expensive. It's time-consuming. It usually requires serious computer and mathematical skills. It's rarely successful, and ultimately it's usually uncertain as to whether it's actually succeeded. Whether someone has been declared to be re-identified is usually not verified. A equally mythical position would be that it works perfectly and permanently. Perfect re-identification isn't possible. It doesn't free the data from all subsequent privacy concerns, and it's never permanently de-identified. That term, as Paul Ohm points out, is really kind of a problem because there's no guarantee that in the future there won't be new ways to re-identify data. I would point you towards this systematic review by Khaled El-Imam and Bradley Mailman and colleagues. One of the papers, or one of the re-identification attempts provided by the Office of the National Coordinator for Health IT in 2011. They attempted re-identification on safe harbor data for 15,000 individuals. They were able to re-identify 2 of them. And I think at that point we have to question why someone would go through the effort to do that. So expert determination is a little bit more flexible than safe harbor, and it helps us balance the competing goals of privacy protection and preserving the utility and statistical accuracy of de-identified data. There are 2 things that I think are important to understand. One is this myth that we can build perfect population registers. Nobody from the Census Bureau, I assume, is here, but they'll tell you how hard it is to get a comprehensive population register. Oftentimes, we have citations of using voter registration lists, and about 70% nationwide are registered to vote. The other thing is variables change over time. We have time dynamics, missing and incomplete data. And just to move through quickly, I'm going to skip through a little bit about record linkage. We have to distinguish between whether someone is unique in the data that we're observing and unique in the larger population. If they're unique in the sample, we call them a sample unique. If they're unique in the larger population, we call them a population unique. And so in our sample, some of those may be unique. In the larger population, only some of those may be unique. And it's really the situation, hopefully you can view these slides after, it's really only those records that are unique in the sample and the population that are at a clear risk of being re-identified using exact record linkage. So I want to show you, we can usually determine sample uniqueness very easily. We can estimate population uniqueness using census data. But I want to very quickly show you some of the risks that come with bad de-identification practice. Tony Cox alluded to well-established methods that help do that well. But one of the problems that we face is that it can distort variance-covariance matrices and mask heterogeneities of subgroups. So we want to separate the signal from the noise, and statistical methods can help reveal those more complex relationships. But for example, when we k-anonymize data to make it all have equivalent variables, we can distort multivariate analyses. I'm going to show you these slides very quickly of geolocation data. This is synthetic data. Nobody's household is really being displayed. But as we move up in the census level to census level, census tract, now we're at the CBSA or core-based statistical level, you see that we just obliterated all of that location data that is so useful for environmental studies. This is a relationship of things that might be considered quasi-identifiers: age, education, and years, and income. And we might be interested in fitting a surface to that as part of our prediction. Unfortunately, if we're going to collapse groupings, if we have this racial heterogeneity and we collapse them all into another group to prevent them from being re-identified, what have we done? We've expanded the variance, and now our statistical test is based off the difference in the variance, and we've gotten to the point where we can no longer even say that there's a difference between the whites and the others in this group. I'm now showing you a 2% sample, and this is why it's important to distinguish between sample unique and population unique. The red dots here are population unique. There's 3.5%. That's a pretty small percent, and there might not even be motivation with that few people re-identifiable to go ahead and try re-identification. So we collapse these categories further. Now our sample uniqueness is down to 8%. Nobody is population unique, but if we're only looking at our sample data, we're going to continue. And so if we get to 0.6%, which is not as low as some have suggested our measure of very small risk should be, we've got one individual who's sample unique, and if we move that all the way to make sure there's nobody who's sample unique, that's what's left of our data. Okay? So this is a very recent published paper on my last slide. These are the percent of coefficients which change significance. And if you look at the ranges there, it might be a little bit hard for you to see, but these range 60%, near 90%, and then the low level for the very best method. To me, this is insanity. If we're going to do this to our statistical analyses, we might as well all give up and go home. Okay? So how do we move beyond anecdotes to rigorous scientific evidence-based risk management approach for dealing with re-identification risks? I would suggest we want to do that using quantitative policy analyses. These have been used for decades by agencies like the EPA and the Energy Department to address difficult risk management questions. There's a lot of uncertainty in re-identification risk assessment, and I think we can use these methods here. And I'll end with that. Thank you.